Hi, I'm Dr. Jeff Glad, Chief Medical Officer of FullScript, the leading healthcare platform for providers to prescribe healthcare's best supplements, drive better patient outcomes, and scale practice growth with unparalleled efficiency. As a healthcare provider, I know that finding time to stay up to date on the latest trends and research in modern medicine can be a daunting task. That's why I'm excited to share a cutting-edge supplement course our team of medical experts worked on in collaboration with A4M and several industry experts, designed to help you navigate supplements and make more informed clinical decisions. Throughout the 16 hours of content, we'll give you the clinical context you'll need to confidently recommend supplements to your patients. The A4M Supplement Certification course is the perfect starting point or clinical update for optimizing your supplement treatment plans to ensure the best possible outcomes for your patients. Go to www.a4m.com/supplement-certification-course.html and use the promo code podcast20 at checkout to get a 20% discount. Enroll today and elevate your whole person care.
Welcome to Redefining Medicine, an intimate and personalized program that illustrates a different side of the practice of medicine. Our in-depth conversations will focus on the physicians and practitioners who are redefining medicine through their integrative, functional, and holistic approach to health and well-being. Our host for Redefining Medicine is Dr. Erica Schwartz. For more than 20 years, Dr. Erica has been at the forefront of advanced patient care, taking the best from conventional and integrative medicine and applying them to prevent disease. Dr. Erica is a distinguished A4M faculty member in disciplines ranging from hormone therapy, peptide therapy, and IV nutritional support.
Welcome to Redefining Medicine. Today, we're interviewing Chris Mirabile. He is the founder and CEO of Novos, which is a very interesting longevity promoting platform. So tell us the whole story. How did it start? How did your journey?
Yes, my journey starts at a young age. So when I was 12 years old, I started getting interested in exercise and health, and I picked up an issue of Men's Health magazine. Mm-hmm. So it was that much more of a surprise to me when I was 16 years old. And I was in New York City at the Federal Reserve Bank in downtown Manhattan. And I suddenly woke up with blood all over my shirt. It turned out I had had a seizure that was caused by an unknown brain tumor.
Wow.
So they rushed me to NYU Medical Center. They gave me the CAT scan and eventual MRI, and they broke the news to me and my family that I had a brain tumor. And so that was an experience that completely shifted my perception of health. Prior to that, it was a superficial definition of health.
But you were 16.
I was 16,
you
yes.
poor thing. Yes.
But I thought health was about doing well in sports and just looking good on the beach or something, right?
Which at 16 it is.
Right. Until this experience where I realized that health is a lot more than that. It's biology and cellular fitness and making sure that essentially we're not coming down with any sort of disease or illness. And so it planted this seed from a very early age where I was interested in longevity as a teenager. And so I never wanted to be laying on a hospital bed again, contemplating my mortality and wondering if I would wake up again the next day. It was such a scary experience. I never wanted to go through that again. Right. And so, you fast forward through the years, there's a lot that has happened since then, but it eventually blossomed into the company Novos, where we focus on trying to slow down the biological aging process, which is, as you know, the number one risk factor for diseases of aging, the number one risk factor for most forms of cancer, for cardiovascular disease, for Alzheimer's, dementia, the list goes on. So that's the origin.
Okay, but that's like a very brief origin. So
Yes.
now go back into the meat of it. And how did you go from here you have a brain tumor to how do you develop a company?
Yeah, so about 10 years ago, I came across a scientific paper in the journal Cell called The Hallmarks of Aging. Mm-hmm. And so why was I looking at scientific journals in the first place? It's because I was always looking to optimize my health however I could. And I didn't want to go to secondary sources as much as I wanted to go to the primary sources, the researchers themselves, to learn the cutting edge, so to speak. And so I came across this paper that for the first time defined the biological root causes of why we get older, or the things that happen as we're getting older from this microscopic perspective. And so that was like a moment of epiphany for me. It was a moment where I realized that what I had been searching for since I was a teenager in terms of how to best optimize my health, not only for today in the short-term goals, but for tomorrow and those long-term goals as well of avoidance of disease, would be best served by looking through the lens of these hallmarks of aging. So from there, I'm not a biologist, I'm not a medical doctor, but I had always a deep interest in the field, and I had been reading scientific papers and experimenting, doing self-experimentation with different diets and supplements and sleep routines and so on, where I had enough of a background to be able to go to scientific conferences with biologists and to pose questions to them, asking about, for example, natural compounds that were found in my research, looking at others' research, to positively impact these different hallmarks of aging. And then asking them if they were optimistic or bullish on the potential behind these ingredients. And I didn't know what the answer would be. I thought, like many medical doctors or traditional medical doctors, they look at supplements as being a waste of money. But we know that's not true, and scientists have proven that that's not the case. And so I was somewhat surprised to hear how optimistic they were about the potential behind these ingredients. And that's when I said, I need to create a company that's able to produce a formulation that's able to address not just one or two of these hallmarks, but all of the hallmarks simultaneously, which was not being done anywhere in the world, including on, in the most advanced biotech companies or pharmaceutical companies and so on. Everything they were doing was focused on inventing new molecules because of the patentability and the lucrative financial return that they can get from patenting a new molecule. But for me, the mission was making this as accessible and achievable for as many people as possible, like my family, my friends, and the community at large. So that's essentially the more extended version of the story of how I started.
I will make it even more extended.
Okay.
So don't worry about that. So go ahead. So this is initially for you because it always has to be personal, otherwise it doesn't work. And then you try to expand it. And how do you wind up with the researchers? What about the clinicians who actually take care of the patients who do practice longevity? Like now you're at A4M, and A4M is like the mecca of doctors and practitioners who focus on longevity, who focus on wellness, on disease prevention, on anti-aging, on eliminating disease. So how do you decide the scientists that you're going to be working with and the clinicians, how you're going to apply it clinically? So tell me more about that.
Sure. So as part of that process of me validating the concept in the first place of creating a company that can address the hallmarks of aging, I networked with and met many different scientists in the field. People like David Sinclair, David Sabatini, George Church, and so on. And some of these people are scientific advisors to us now, like George Church, who invented the first method of direct genome sequencing in 1984. I mean, he's a legend in the field of biology.
Right.
Matt Kaberlein advises us. He is very famous for his work with rapamycin and the dog aging project and slowing down aging of dogs. Robert Lufkin, who is a radiologist out of USC and UCLA. So networking with these people, and what were the qualifications? Well, they had to have a lot of knowledge in the field of longevity and the latest cutting edge perspectives on longevity, specifically knowing about at least one or multiple of these different biological hallmarks of aging. So whether that be genomic instability on the DNA level, or loss of proteostasis, cellular senescence, epigenetics and the reprogramming of the epigenome, and so on. So we were looking for people that had a wide range of skills and comprehension and knowledge in these fields so that they could advise us when we were putting together the initial formulation with unique insights that go beyond the scientific papers, because many people don't know this, but your sophisticated audience most likely does, that what you see in the scientific paper is only one layer of the research. The scientist knows 100 times more than what's presented in that paper. And so we wanted to go to the scientists and get their insights that you couldn't read from PubMed, that you have to talk to them firsthand and understand. And so together with my co-founder, we put together the plan for the formulation. He's a medical doctor and longevity researcher. And we presented it to the scientists and the team and got their feedback on different ingredients. And for example, there's ingredients that we removed from the formula, and there are ingredients we added to the formula. Now, where did we find these ingredients in the first place? We consulted many different sources, but one of the most promising, powerful sources is something called the Drug Age Database. The Drug Age Database, ironically, was created by one of our scientists on our team. He's actually the head of our R&D team, named Dr. Diogo Berardo. So this was an idea that he had while under Pedro Malgajes' lab. This is at the University of Liverpool, to basically catalog all of the longevity promoting compounds in the world. So every single scientific study that has ever found an ingredient could extend the lifespan of any species, it's in this database. And so we first wanted to see which compounds could increase lifespan by the most across ideally multiple species. Because if it's working for multiple species, then that hints at the pathways that we're targeting being evolutionarily conserved, and therefore most likely present in humans as well, and would therefore lead to a longer lifespan in humans as well, which is hard to test, obviously, because of how long we live. Right. We also wanted to make sure that they were all natural, that they were safe, that they were either in human biology or something that we have been consuming for decades, or if not even millennia. And a number of other qualifications that we have on our website. If you go to novoslabs.com/approach, we talk about that approach that we took to the formulation. And then from there, we put together candidate formulas. We did testing with a few dozen friends and family members to just make sure there were no negative side effects, and we made some iterations and tweaks. And then beyond the scientific testing, we have amazing results with real-world customers. So
how do you get your customers?
So we're direct to consumer, or at least that's how we founded the company, and we've been growing fantastically. We've been covered in the Wall Street Journal, Business Insider, Fortune magazine, Forbes, and so on, because of the innovative approach that we're taking to longevity. And I've been focusing on the formulations, but we also offer biological age testing. So we look at your epigenome, and we are leveraging the work of researchers at Columbia and Duke University that created what's known as the Dunedin Pace Clock. And this clock is the most accurate and precise of all biological age clocks out there. It's able to tell you what rate at which you're currently aging. And it's something that can change with your lifestyle. So, which is very empowering for our customers to be aware of, because no matter what score you get, you can improve it by integrating different lifestyle methodologies or our formulation. So for example, we did a case study where we had people aged from their 30s into their 70s taking Novos, and half male, half female. After 6 months of consuming Novos, 73% of them reduced their biological pace of aging, according to this third-party Duke Columbia test, and 0% accelerated their aging. And the p-value, the probability that this was coincidence, was less than 1 in 1,000. So
that's impressive. Yeah.
Thank you. So, but then the real-world effects of this, we have customers. For example, there's a customer of ours by the name of Julie Gibson Clark, who just got coverage in Fortune, Business Insider, and News Nation interviewed her on television because she's ranked number 2 in the world for this competition called the Rejuvenation Olympics, where she's outperforming
What's
people.
That?
So the Rejuvenation Olympics is a leaderboard that was set up by a third party, not us, who is basically tracking the rate at which people are biologically aging, and then also adding a little bit of a competition to it for fun.
Right.
And
sounds like fun.
Yeah, and so there are people on that board spending millions of dollars per year trying to slow down their aging and getting a lot of press for what they're doing. But our customers, not only Julie, she's one, but multiple of our customers are outperforming these people spending millions of dollars only by incorporating our formulations into their routine.
Just the packets.
So this is Novos Core.
Right.
So we have 2 products right now. We have a third coming out in January, but the 2 products are Novos Core and Novos Boost. Novos Core, this is the foundation. This is 12 ingredients. This is what we're most proud of and have a patent filed for. Novos Boost is 1 ingredient. It's nicotinamide mononucleotide, or NMN, the NAD precursor. And so we recommend people stack them and take them together, but if you take only one, we would recommend Core. So these people are taking Core and Boost. They are, Julie, for example, is ranked number 2 in the world. She's a single mother making less than 6 figures, living in Arizona, 55 years old, and she's outperforming people spending millions. So
amazing.
It's what we're all about is making longevity accessible and achievable for as many people as possible.
Sounds great.
We feel like longevity is oftentimes it's positioned as something for billionaires and millionaires and only for the ultra rich, but we want this to be something that anyone, regardless of their financial means, can incorporate into their lives.
Well, it sounds great, and it should be that way, because you know what? It shouldn't be just for the rich, and there's no reason why we can't change our lifestyle and change little things to improve our lifespan. So Novo seems to be right there. So it's great to have you here. Thank you so much for joining us.
Thank you.